What is a food safety risk assessment really? We all know what a food safety risk assessment is, right? Well, sort of. I thought it was time to brush up on the basics and get down to the nitty-gritty of risk assessments. Risk is the effect of uncertainty on objectives, according to ISO 31000 risk management. In food safety, we define risk as a function of the probability of an adverse health effect and the severity of that effect consequential to a hazard in food. And that definition is from the Food and Agriculture Organization. Put more simply, risk is the chance that something bad will happen. For example, the probability of a person becoming sick from salmonella in fruit salad. A risk assessment is a scientific process that attempts to determine the size of a risk and the factors that impact it. Risk assessments are performed using data from scientific literature or other high-quality data sets. While other risk assessments can be broad and include things like financial risks, reputational damage, or work health and safety, food safety risk assessments focus solely on the risks to consumers from hazards in foods. These can be biological, chemical, or physical hazards. Food safety risk assessments are performed by experts in academia and government agencies who use the results to inform the industry of risks, create guidelines, and set food regulations. Food safety managers and other qualified individuals in food manufacturing also perform risk assessments during the development and maintenance of food safety programs. A food safety risk assessment consists of the following 4 steps as outlined by the Food and Agriculture Organization within the Codex Alimentarius framework. 1. Hazard identification. 2. Hazard characterization. 3. Exposure assessment. And 4. Risk characterization. In the hazard identification step, the persons conducting the risk assessment identify biological, chemical, and physical agents capable of causing illness or injury in a food. Each hazard is then characterized with respect to the types of adverse health effect and their severity. For example, the relationship between consumers being exposed to a hazard such as salmonella and the likelihood of disease, as well as the severity of the disease. Factors such as the characteristics of the consumers, the virulence of the salmonella, and effects from the food matrix are considered. If enough data is available, a dose-response relationship should be used. This is a mathematical relationship between the size of the dose of a hazard, for example, how many cells of salmonella are in a serving of food, and the probable severity and/or frequency of the associated illnesses. The exposure assessment step provides a quantitative measure of how much of the hazard may reach a consumer. The exposure assessment process requires an understanding of how much food is likely to be consumed, as well as the probable concentration of the hazard in the food. Risk characterization is the final step in the risk assessment process. It combines the findings from the first 3 steps to create an estimate of the probability, that's occurrence and severity, of injury or illness occurring based on the hazards identified, their characterizations, and the exposure assessment. The estimate can be risk per portion of food or risk per population and may be qualitative, semi-qualitative, or quantitative. Quantitative risk assessments use probabilistic modelling to generate numerical estimates for consumer risk. For example, if fruit salad contains 1 CFU per gram of salmonella and the average consumer eats 150 grams of fruit salad per serve, then the risk might be quantified as 1 illness per 10,000 servings. And just noting that those numbers are for illustration purposes only. A qualitative risk assessment is performed when there isn't enough data to perform a quantitative risk assessment. Qualitative assessments make use of descriptive terms such as negligible, low, medium, or high. The process relies on a subjective description of quantities based on expert opinions. For example, if the hazard is defined as 25 CFU per gram of salmonella in fruit salad, an expert might say that an illness is likely to occur and the consequences would be moderately severe. As such, the expert might conclude the risk is high. Qualitative risk assessments are faster than quantitative risk assessments and can be performed to address day-to-day scenarios and make real-time decisions in food manufacturing, such as whether or not to release product for sale, accept incoming raw materials, or approve a change to a process. Such risk assessments can be made without detailed analysis and in the absence of probability data using a risk matrix such as a 5x5 matrix, and there is an image of that in the email and the post. You can learn more. The World Health Organization's published a guidance called Microbiological Risk Assessment Guidance for Food, which provides a structured framework for assessing the risk of microbiological hazards in food. There is an on-demand webinar on YouTube that is about an hour and a half long. It explains quantitative risk assessments for allergens. And I've written about the science and politics of risk management in issue 85 and explained hazards versus risk in issue 86 of The Rotten Apple. And you'll find links to those in the email and the post.